what are the common connections between PTSD, nightmares, and insomnia, and how can survivors begin to break that cycle? So we kind of touched on that a little bit.
Yeah, so they are separate disorders, separate issues in that they all recognize sleep disorders or mental health disorder in PTSD's case. But there is overlap without question. So people with PTSD often suffer from nightmares and insomnia.
Hmm.
Um, People with nightmares often suffer with insomnia. There's a huge amount of overlap between them, but they are kind of separate entities. There are really effective treatments for all of them. So for PTSD, there are trauma focused therapies, there are
Yeah.
medications that can be very helpful for it as well.
Hmm.
Um, for nightmares, there is um, a type of therapy known as imagery rehearsal therapy, which helps the sufferer to change the particularly effective for kind of recurrent nightmares of a similar kind of ilk, and they help the sufferer to rewrite the script of their nightmare.
Oh,
And so you change the narrative. So and over time
yeah.
you repeat that kind of script to yourself before you go to bed, and eventually it becomes ingrained in your brain. And the idea is that it transfers itself to the nightmare, and you change the narrative to a positive one or a happy ending kind of thing. And that has really effective.
Mm.
Lots of evidence behind the effectiveness for that. And for insomnia, there are drug treatments, but really the first line treatment for everybody with insomnia, or almost everybody with insomnia, should be CBTI, cognitive behavioral therapy for insomnia. Now, I think in the sleep world, this needs a bit of a rebrand because people hear CBT and think, oh well, I've done CBT for anxiety and depression. I know what
Uh-huh.
that is already, or I did it for anxiety and it didn't work, or whatever. And it really isn't anything like CBT for anxiety and depression. It's very much its own thing. It's really a different kettle of fish. The way that we explain it at the Sleep Project is CBTI is very much like a toolbox of techniques and tricks that help you to understand how sleep works and teach you techniques to turn around insomnia and to nip it in the bud in different areas depending on what your particular problem is. And usually, what happens is people um, don't necessarily take all of the techniques on board. Not every technique fits for every person,
Right.
but they find the one or two or three
Mm-hmm.
techniques that work for them, and they're the ones that they use going forward. And we know that CBTI works for approximately 80% of people with insomnia, even if you had it for
Wow.
decades. Even if you had it for decades, and as well as being drug free without the side effects, it
Mm-hmm.
also helps those people to stay insomnia free for years to come because they've learned the skills and the techniques that they can use to keep their sleep good and to treat any kind of recurrences of insomnia that happen further down the line. So they all have they're all recognised disorders with their own specific treatments,
Mm-hmm.
and all the treatments have been shown to be really effective in studies and trials,
And drug free.
and are drug free. Yeah, yeah,
Yeah, and
absolutely.
not that there's a place for medication, but I'm always a firm believer that try what you can without medication first, because sometimes it can be just something really simple, and then you don't need to take the medication and all the side effects and everything that affect you.
I
So,
couldn't agree more. There absolutely is a place for medication in this world, but over the last few decades, I think that the focus in medicine has
hmm,
gone too much towards
yeah,
medications
yeah,
and not enough towards some of the lifestyle factors that not only will treat the condition without the need for medication, but will help that person to live a healthier,
hmm,
better life in the long run over the decades to come.
exactly. And you're empowering them, right? You're giving them their
Absolutely.
power back.
Yeah.
they can manage this rather than it managing them.
So
That's what's so
important.
frustrating.
So important. Yeah.
I just remember that was the most frustrating thing for me is I had no way of managing this that I can't sleep. Oh, so
Yeah.
frustrating. And you have
Yeah.
night after night after night of that, and it just is wearing on you.